Question 1. A nurse is caring for a patient receiving ACE inhibitors. Which of the following lab results should be closely monitored? A. Serum potassium levels. B. Liver enzymes, ALT-AST. C. White blood cell count. D. Blood urea nitrogen, BUN. Answer. A. Serum potassium levels. Rationale. ACE inhibitors can cause hyperkalemia, so potassium levels should be monitored closely. The other lab results are important, but not directly affected by ACE inhibitors. Question 2. A patient is prescribed amiodarone for ventricular arrhythmias. What is a potential serious side effect of this medication that the nurse should monitor for? A. Hypoglycemia. B. Pulmonary toxicity. C. Hypertension. D. Urinary retention. Answer. B. Pulmonary toxicity. Rationale. Amiodarone can cause pulmonary toxicity, which can lead to respiratory distress. The nurse should monitor the patient for signs of pulmonary complications. Question 3. A patient with chronic kidney disease is prescribed erythropoiesis-stimulating agents, ESAs. What is the primary concern the nurse should address? A. Risk of thromboembolism. B. Risk of hyperkalemia. C. Risk of hypotension. D. Risk of electrolyte imbalance. Answer. A. Risk of thromboembolism. Rationale. ESAs can increase the risk of thromboembolic events, such as stroke or deep vein thrombosis, DVT. The nurse should monitor for signs of clotting and manage accordingly. Question 4. A nurse is administering insulin to a patient with type 1 diabetes. What is the most important patient education point about the medication? A. You should rotate injection sites to prevent lipodystrophy. B. You can skip meals if you don't feel hungry. C. This medication should be taken with food to enhance absorption. D. You need to check your blood glucose only when you feel symptoms of hypoglycemia. Answer. A. You should rotate injection sites to prevent lipodystrophy. Rationale. Rotating injection sites helps prevent the development of lipodystrophy, fat atrophy, or hypertrophy, which can affect insulin absorption. Skipping meals or only checking glucose during symptoms is unsafe practice. Question 5. A nurse is preparing to administer warfarin. The patient has a therapeutic INR of 2.8. What should the nurse do next? A. Administer the next dose of warfarin as scheduled. B. Withhold the next dose of warfarin and notify the healthcare provider. C. Administer vitamin K immediately. D. Increase the dose of warfarin. Answer. A. Administer the next dose of warfarin as scheduled. Rationale. An INR of 2.8 is within the therapeutic range for patients on warfarin therapy. There is no need to adjust the dose or administer vitamin K at this time. Question 6. A patient with a history of peptic ulcer disease is prescribed an NSAID for pain management. What is the nurse's priority concern? A. Risk of hypoglycemia. B. Risk of gastrointestinal bleeding. C. Risk of respiratory depression. D. Risk of renal toxicity. Answer. B. Risk of gastrointestinal bleeding. Rationale. NSAIDs can cause gastrointestinal irritation, ulceration, and bleeding, especially in patients with a history of peptic ulcers. The nurse should monitor for signs of bleeding. Question 7. A patient is prescribed an opioid for post-surgical pain. What is the most important nursing action? A. Monitor for signs of constipation and provide laxatives. B. Increase the opioid dose to ensure pain relief. C. Monitor the patient's blood pressure regularly. D. Administer the opioid with food to prevent nausea. Answer. A. Monitor for signs of constipation and provide laxatives. Rationale. Opioids can cause constipation, so the nurse should monitor bowel function and provide interventions like laxatives to prevent discomfort and complications. Question 8. A patient is receiving intravenous IV potassium chloride. Which of the following is a key safety measure when administering this medication? A. Administer the medication at a fast rate to avoid irritation. B. Dilute the medication in at least 100 milliliters of fluid and infuse slowly. C. Administer potassium chloride undiluted through a large vein. D. Check the patient's liver function tests regularly. Answer. B. Dilute the medication in at least 100 milliliters of fluid and infuse slowly. Rationale. Potassium chloride should be diluted and infused slowly to prevent complications such as arrhythmias and irritation at the IV site. Fast administration or undiluted solutions can cause severe side effects. Question 9. A nurse is preparing to administer a dose of ciprofloxacin to a patient with a urinary tract infection. What is the priority patient education regarding this medication? A. Drink plenty of fluids and avoid sun exposure. B. Take this medication with food to avoid stomach upset. C. Avoid taking any antacids or iron supplements with this medication. D. This medication may cause drowsiness. Avoid operating machinery. Answer. A. Drink plenty of fluids and avoid sun exposure. Rationale. Ciprofloxacin can cause photosensitivity, and adequate hydration is important to reduce the risk of kidney stones. It's crucial to avoid sun exposure while taking this medication. Question 10. A patient is prescribed clindamycin for a soft tissue infection. Which of the following should the nurse monitor for as a serious adverse effect? A. Severe diarrhea and abdominal cramping. B. Jaundice and dark urine. C. Hypotension and dizziness. D. Tachycardia and palpitations. Answer. A. Severe diarrhea and abdominal cramping. Rationale. Clindamycin can cause Clostridium difficile-associated diarrhea, a severe and potentially life-threatening condition. The nurse should monitor for symptoms of gastrointestinal distress. Question 11. A nurse is caring for a patient who is prescribed lithium for bipolar disorder. Which of the following signs suggests lithium toxicity? A. Tremors and confusion. B. Hypotension and dry mouth. C. Increased appetite and weight gain. D. Blurred vision and dizziness. Answer. A. Tremors and confusion. Rationale. Tremors and confusion are signs of lithium toxicity. Other symptoms may include nausea, vomiting, and ataxia. Question 12. A patient is prescribed a combination of furosemide and digoxin for heart failure. Which electrolyte imbalance should the nurse monitor for closely? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypernatremia. Answer. B. Hypokalemia. Rationale. Furosemide, a diuretic, can cause potassium loss, leading to hypokalemia, which increases the risk of digoxin toxicity. Question 13. A nurse is preparing to administer an oral dose of digoxin. The patient's heart rate is 52 beats per minute. What is the nurse's next action? A. Administer the digoxin dose as prescribed. B. Withhold the digoxin dose and notify the healthcare provider. C. Increase the digoxin dose to improve heart rate. D. Administer a dose of atropine to increase heart rate. Answer. B. Withhold the digoxin dose and notify the healthcare provider. Rationale. A heart rate below 60 bpm is a sign of bradycardia, which may be exacerbated by digoxin. The dose should be withheld and the healthcare provider notified. Question 14. A nurse is administering morphine to a postoperative patient. Which of the following should the nurse monitor closely? A. Respiratory rate. B. Blood pressure. C. Blood glucose levels. D. Electrolyte levels. Answer: a respiratory rate. Rationale: morphine can cause respiratory depression, so it's important to monitor the respiratory rate closely. Question 15. A patient is prescribed rifampin for tuberculosis. Which of the following side effects should the nurse inform the patient about? A. Jaundice and dark urine. B. Red-orange discoloration of bodily fluids. C. Tachycardia and palpitations. D. Dizziness and blurred vision. Answer: B. Red-orange discoloration of bodily fluids. Rationale: rifampin can cause a red-orange discoloration of urine, sweat, tears, and other bodily fluids, which is a harmless but important side effect to inform the patient about. Question 16. A patient is receiving warfarin therapy. The nurse notes that the patient's INR is 4.5. What is the nurse's priority action? A. Increase the warfarin dose. B. Administer vitamin K and notify the healthcare provider. C. Decrease the warfarin dose and continue therapy. D. Administer heparin to reverse the effects of warfarin. Answer: B. Administer vitamin K and notify the healthcare provider. Rationale: an INR of 4.5 indicates an elevated risk of bleeding. Vitamin K is administered to reverse the effects of warfarin, and the healthcare provider should be notified. Question 17. A patient is prescribed hydrochlorothiazide for hypertension. What is the nurse's priority assessment? A. Potassium levels. B. Serum glucose levels. C. Respiratory rate. D. Liver enzymes. Answer: A. Potassium levels. Rationale: hydrochlorothiazide is a thiazide diuretic that can cause hypokalemia, so potassium levels should be monitored closely. Question 18. A nurse is caring for a patient who is receiving ciprofloxacin for a urinary tract infection. Which of the following should the nurse educate the patient to avoid? A. Taking the medication with dairy products. B. Engaging in moderate physical activity. C. Taking the medication with food to reduce stomach upset. D. Using sunscreen and avoiding direct sunlight. Answer: D. Using sunscreen and avoiding direct sunlight. Rationale: ciprofloxacin can increase photosensitivity, leading to an increased risk of sunburn. The patient should be advised to use sunscreen and avoid prolonged sun exposure. Question 19. A nurse is caring for a patient receiving an intravenous IV infusion of potassium chloride. The patient begins to complain of pain at the infusion site. What is the nurse's first action? A. Increase the infusion rate to alleviate discomfort. B. Stop the infusion and assess the site for signs of infiltration. C. Apply a warm compress to the infusion site. D. Document the pain and continue the infusion. Answer: B. Stop the infusion and assess the site for signs of infiltration. Rationale: potassium chloride can cause irritation or infiltration, so the nurse should stop the infusion and assess the site for signs of extravasation or infiltration before continuing. Question 20. A nurse is caring for a patient on antiplatelet therapy with clopidogrel. Which of the following signs indicates a potential complication? A. Bleeding gums and bruising. B. Dizziness and headache. C. Increased blood pressure. D. Shortness of breath and wheezing. Answer: A. Bleeding gums and bruising. Rationale: antiplatelet therapy with clopidogrel increases the risk of bleeding. Bleeding gums and unexplained bruising are signs of bleeding complications that the nurse should monitor closely. Question 21. A patient with diabetes is prescribed metformin. What is the nurse's priority concern regarding this medication? A. Risk of hypoglycemia. B. Risk of lactic acidosis. C. Risk of hypertension. D. Risk of hyperkalemia. Answer: B. Risk of lactic acidosis. Rationale: metformin can increase the risk of lactic acidosis, especially in patients with kidney impairment or other contraindications. Hypoglycemia is not common with metformin alone. Question 22. A nurse is caring for a patient receiving an IV infusion of magnesium sulfate for eclampsia. Which of the following is a sign of magnesium toxicity? A. Increased reflexes. B. Respiratory depression. C. Decreased urinary output. D. Tachycardia. Answer: B. Respiratory depression. Rationale: magnesium sulfate toxicity can cause respiratory depression, which is life-threatening and requires immediate attention. Other symptoms include bradycardia and diminished reflexes. Question 23. A nurse is caring for a patient prescribed propofol for sedation. What is the nurse's priority assessment during the infusion? A. Heart rate. B. Respiratory rate. C. Blood pressure. D. Oxygen saturation. Answer: B. Respiratory rate. Rationale: propofol can cause significant respiratory depression, so the nurse should monitor the respiratory rate closely during infusion. Oxygen saturation may also be helpful, but respiratory rate is the priority. Question 24. A nurse is administering an opioid to a patient for pain relief. The patient develops pinpoint pupils, respiratory depression, and hypotension. What is the nurse's immediate action? A. Administer naloxone Narcan. B. Increase the opioid dose. C. Administer a benzodiazepine. D. Continue to monitor the patient's vital signs. Answer: A. Administer naloxone Narcan. Rationale: the patient is showing signs of opioid overdose, and naloxone Narcan is the antidote to reverse opioid toxicity. Increasing the opioid dose or administering benzodiazepines is not appropriate in this case. Question 25. A patient is prescribed a statin for hyperlipidemia. Which of the following is the most important laboratory test the nurse should monitor? A. Liver function tests, ALT/AST. B. Serum potassium levels. C. Hemoglobin and hematocrit. D. Serum glucose levels. Answer: A. Liver function tests, ALT/AST. Rationale: statins can cause liver toxicity, so monitoring liver function tests is essential. Other lab tests are important, but not as directly related to statin therapy. Question 26. A patient is receiving a continuous infusion of heparin. The nurse should monitor which laboratory value to assess the therapeutic effect of the heparin? A. Activated partial thromboplastin time, APTT. B. Prothrombin time, PT. C. Platelet count. D. Hemoglobin and hematocrit. Answer: A. Activated partial thromboplastin time, APTT. Rationale: heparin's therapeutic effect is monitored by the APTT, which measures the time it takes for blood to clot. PT and platelet count are not used to monitor heparin. Question 27. A nurse is administering acetaminophen to a patient. Which of the following is a priority safety concern? A. Hepatotoxicity, especially in high doses or with alcohol use. B. Risk of gastrointestinal bleeding. C. Respiratory depression. D. Renal toxicity. Answer: A. Hepatotoxicity, especially in high doses or with alcohol use. Rationale: acetaminophen is metabolized by the liver, and overdose can lead to severe hepatotoxicity, especially when combined with alcohol. The other concerns are not common side effects of acetaminophen. Question 28. A patient is prescribed tetracycline for an infection. Which of the following patient instructions should the nurse provide? A. Take this medication with milk to prevent stomach upset. B. Avoid taking this medication with dairy products or antacids. C. Take the medication only with water to improve absorption. D. Increase your intake of vitamin D while taking this medication. Answer: B. Avoid taking this medication with dairy products or antacids. Rationale: tetracycline binds with calcium in dairy products and antacids, which decreases its absorption. It should be taken on an empty stomach or with water to enhance absorption. Question 29. A nurse is caring for a patient receiving vancomycin. What is the nurse's priority assessment? A. Serum creatinine and urine output. B. Serum potassium levels. C. Blood pressure. D. Heart rate. Answer: A. Serum creatinine and urine output. Rationale: vancomycin is nephrotoxic, and the nurse should monitor renal function closely, including serum creatinine and urine output. Question 30. A nurse is administering oral metronidazole to a patient with an infection. What is the most important patient education? A. Avoid alcohol during treatment due to the risk of severe nausea and vomiting. B. Take the medication with dairy products to avoid gastrointestinal upset. C. You should drink extra fluids to prevent dehydration. D. You can discontinue the medication once you feel better. Answer: A. Avoid alcohol during treatment due to the risk of severe nausea and vomiting. Rationale: metronidazole can cause a severe disulfiram-like reaction when taken with alcohol, resulting in nausea, vomiting, and other symptoms. Question 31. A nurse is caring for a patient receiving an intravenous infusion of mannitol for increased intracranial pressure. What is the nurse's priority assessment? A. Serum glucose levels. B. Urine output and renal function. C. Blood pressure. D. Electrolyte levels. Answer: B. Urine output and renal function. Rationale: mannitol is an osmotic diuretic that can cause dehydration and affect renal function. The nurse should monitor urine output and renal function to prevent complications. Question 32. A nurse is administering dopamine to a patient in shock. What is the nurse's primary concern when administering this medication? A. Risk of hypertension. B. Risk of tissue necrosis at the injection site. C. Risk of hypoglycemia. D. Risk of respiratory depression. Answer: B. Risk of tissue necrosis at the injection site. Rationale: dopamine can cause severe tissue necrosis if extravasation occurs. The nurse should ensure proper IV placement and monitor the site carefully. Question 33. A patient is receiving an intravenous infusion of lidocaine for arrhythmias. Which of the following is a serious side effect that the nurse should monitor for? A. Hypertension. B. Respiratory depression. C. Seizures. D. Tachycardia. Answer: C. Seizures. Rationale: lidocaine is a local anesthetic and antiarrhythmic that can cause seizures, particularly in higher doses or with toxicity. Question 34. A nurse is caring for a patient receiving acetaminophen for pain management. What is the most important aspect of monitoring for this patient? A. Liver function. B. Serum electrolytes. C. Blood glucose levels. D. Blood pressure. Answer: A. Liver function. Rationale: acetaminophen can cause liver toxicity, particularly with overdose or long-term use. Liver function tests, for example ALT, AST, should be closely monitored. Question 35. A patient is prescribed warfarin therapy for atrial fibrillation. What should the nurse educate the patient about regarding diet? A. You should avoid foods high in vitamin K. B. You should increase your intake of high-fat foods. C. You can eat large amounts of green leafy vegetables. D. You should avoid drinking water while on this medication. Answer: A. You should avoid foods high in vitamin K. Rationale: vitamin K can interfere with warfarin's anticoagulant effect. The patient should avoid large amounts of vitamin K-rich foods like spinach and kale. Question 36. A nurse is administering vancomycin to a patient. What is the most important action to reduce the risk of toxicity? A. Administer the drug slowly over at least 60 minutes. B. Administer the drug rapidly through a large vein. C. Increase the dose based on renal function. D. Monitor for signs of hyperkalemia. Answer: A. Administer the drug slowly over at least 60 minutes. Rationale: rapid infusion of vancomycin can cause red man syndrome, a severe histamine reaction. The drug should be infused slowly to minimize this risk. Question 37. A nurse is caring for a patient receiving a calcium channel blocker. Which of the following side effects should the nurse monitor for? A. Tachycardia. B. Hypotension. C. Hyperkalemia. D. Hyperglycemia. Answer: B. Hypotension. Rationale: calcium channel blockers can cause vasodilation, leading to hypotension. The nurse should monitor blood pressure closely. Question 38. A nurse is caring for a patient receiving methotrexate for rheumatoid arthritis. What is the nurse's priority monitoring? A. Serum potassium levels. B. Liver function tests. C. Serum glucose levels. D. Blood pressure. Answer: B. Liver function tests. Rationale: methotrexate can cause liver toxicity, so monitoring liver function, AST, is essential during therapy. Question 39. A nurse is administering naloxone to a patient who is suspected of an opioid overdose. What is the nurse's priority assessment after administering naloxone? A. Heart rate. B. Respiratory rate. C. Blood pressure. D. Oxygen saturation. Answer: B. Respiratory rate. Rationale: naloxone reverses opioid-induced respiratory depression, so the nurse should monitor the respiratory rate closely. Question 40. A patient with asthma is prescribed a corticosteroid inhaler. What is the nurse's most important patient education? A. Rinse your mouth after using the inhaler to prevent oral thrush. B. Use the inhaler only when you have an asthma attack. C. Take the medication only with food to avoid stomach upset. D. Increase your fluid intake to prevent dehydration. Answer: A. Rinse your mouth after using the inhaler to prevent oral thrush. Rationale: corticosteroid inhalers can cause oral thrush, so it is important for the patient to rinse their mouth after use to prevent fungal infections. Question 41. A nurse is caring for a patient receiving vancomycin for a severe infection. The patient's serum creatinine level has increased from 1.2 milligrams per deciliter to 2.4 milligrams per deciliter. What is the nurse's priority action? A. Administer a higher dose of vancomycin to enhance the therapeutic effect. B. Continue the vancomycin and monitor renal function more frequently. C. Discontinue vancomycin and notify the healthcare provider for potential renal toxicity. D. Decrease the vancomycin dose by half and continue monitoring the patient. Answer: C. Discontinue vancomycin and notify the healthcare provider for potential renal toxicity. Rationale: vancomycin is nephrotoxic, and a significant increase in creatinine indicates potential renal impairment. The nurse should discontinue the medication and notify the healthcare provider. Question 42. A nurse is caring for a patient receiving a combination therapy of a thiazide diuretic and an ACE inhibitor. The nurse notes that the patient's serum potassium is 3.0 milliequivalent per liter. What is the nurse's priority action? A. Administer potassium supplements and monitor electrolytes. B. Decrease the diuretic dose and continue the ACE inhibitor. C. Hold the ACE inhibitor dose and monitor the potassium level. D. Increase the thiazide diuretic dose to lower blood pressure. Answer: A. Administer potassium supplements and monitor electrolytes. Rationale: thiazide diuretics can cause hypokalemia, and the combination with an ACE inhibitor may exacerbate potassium loss. The nurse should administer potassium supplements and closely monitor electrolyte levels. Question 43. A patient with a history of asthma is prescribed a combination inhaler containing fluticasone and salmeterol. The nurse should monitor the patient for which of the following potential complications? A. Increased risk of oral candidiasis. B. Severe bradycardia. C. Hyperglycemia and increased appetite. D. Increased risk of sinusitis and upper respiratory infections. Answer: A. Increased risk of oral candidiasis. Rationale: the corticosteroid in the combination inhaler increases the risk of oral candidiasis thrush. The nurse should instruct the patient to rinse their mouth after use to reduce this risk. Question 44. A nurse is caring for a patient on multiple antihypertensive medications, including an ACE inhibitor and a calcium channel blocker. The patient develops symptoms of dizziness and lightheadedness. What is the nurse's priority action? A. Increase fluid intake to help with dizziness. B. Monitor the patient's blood pressure in both supine and standing positions for orthostatic hypotension. C. Administer an antihistamine to alleviate dizziness. D. Decrease the dose of the calcium channel blocker. Answer: B. Monitor the patient's blood pressure in both supine and standing positions for orthostatic hypotension. Rationale: ACE inhibitors and calcium channel blockers can both cause vasodilation and contribute to orthostatic hypotension. The nurse should monitor the patient's blood pressure when changing positions to assess for this complication. Question 45. A nurse is administering an IV dose of potassium chloride to a patient. The nurse observes that the infusion site is swollen and warm to the touch. What is the nurse's priority action? A. Continue the infusion at a slower rate. B. Stop the infusion and assess for signs of extravasation or infiltration. C. Administer a second dose of potassium chloride via a different site. D. Apply a cold compress to the site and continue monitoring. Answer: B. Stop the infusion and assess for signs of extravasation or infiltration. Rationale: potassium chloride can cause severe tissue damage if it leaks into the surrounding tissue. The nurse should stop the infusion immediately, assess the site for extravasation, and notify the healthcare provider. Question 46. A patient is prescribed clopidogrel after a recent stroke. The patient asks if they can take their usual aspirin regimen with the clopidogrel. What is the nurse's response? A. Yes, it's safe to take both medications together. B. You should avoid taking aspirin with clopidogrel due to an increased risk of bleeding. C. Aspirin can enhance the effects of clopidogrel, so you should take it together for maximum benefit. D. Taking both medications may decrease the effectiveness of clopidogrel, so you should avoid aspirin. Answer: B. You should avoid taking aspirin with clopidogrel due to an increased risk of bleeding. Rationale: combining clopidogrel, an antiplatelet, with aspirin increases the risk of bleeding. The nurse should advise the patient to avoid taking both drugs unless prescribed by the healthcare provider. Question 47. A nurse is administering a dose of levothyroxine to a patient with hypothyroidism. The nurse should instruct the patient to take this medication. A. On an empty stomach, 30 minutes before breakfast. B. With a large meal to prevent gastrointestinal upset. C. After lunch to promote better absorption. D. At bedtime, as it works best overnight. Answer. A. On an empty stomach, 30 minutes before breakfast. Rationale. Levothyroxine should be taken on an empty stomach, 30 minutes before food, to ensure optimal absorption. Taking it with food can interfere with its absorption and reduce its effectiveness. Question 48. A nurse is caring for a patient on long-term use of prednisone for chronic inflammation. Which of the following is a potential complication the nurse should monitor for? A. Hyperkalemia. B. Cushing's syndrome. C. Hypotension. D. Hypoglycemia. Answer. B. Cushing's syndrome. Rationale. Long-term corticosteroid use, such as prednisone, can lead to Cushing's syndrome, characterized by weight gain, moon face, and buffalo hump. The nurse should monitor for these signs and symptoms. Question 49. A nurse is educating a patient receiving ciprofloxacin about potential side effects. Which of the following should the nurse include in the teaching? A. You may experience muscle pain or weakness, and you should stop the medication if this occurs. B. This medication can cause drowsiness, so avoid activities that require mental alertness. C. You should increase your fluid intake to prevent kidney damage. D. It is important to take this medication with dairy products to improve absorption. Answer. A. You may experience muscle pain or weakness, and you should stop the medication if this occurs. Rationale. Ciprofloxacin, a fluoroquinolone, can cause tendinitis and tendon rupture, particularly in older adults. The patient should report muscle pain or weakness immediately. Question 50. A nurse is caring for a patient receiving a combination of acetaminophen and codeine for pain relief. The patient reports feeling drowsy and nauseous. What should the nurse do next? A. Increase the acetaminophen dose to improve pain control. B. Administer an antiemetic for nausea and monitor for respiratory depression. C. Discontinue the combination medication and switch to another analgesic. D. Encourage the patient to take the medication with food to prevent nausea. Answer. B. Administer an antiemetic for nausea and monitor for respiratory depression. Rationale. Codeine can cause drowsiness and nausea. The nurse should administer an antiemetic for nausea and monitor closely for signs of respiratory depression, which is a serious side effect of opioids. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.